Hi, I'm Chris Henry. I'm an orthodontist and I practice here in St. Johns County. I relocated out of Alaska. I decided that I needed to be a little bit closer to family here. So I made the difficult decision to sell my practice there in the central part of Alaska and relocate. Not only having family here has made it a lot more fun for me to kind of take kids to soccer, take kids to gymnastics, even preschool, and play in the playground. And to kind of thaw out a little bit, honestly. But I'm looking at every opportunity, especially since it's beautiful weather here in the St. Johns County. Beyond that, I love the culture. Moving to this area for me was a lot like kind of where I grew up. I grew up next to New Orleans, down in South Mississippi. Not only in this area are there the large oak trees, but there's also the architects, there's the culture, there's the food that continue to remind me what it feels like to be back home. For a number of years, since I was probably in junior high, I thought that I would want to go into medical school. And I happened to be really good with my hands. I took some pottery classes and art classes, and I was able to kind of visualize things in my chemistry classes three-dimensionally. And once getting in dental school, I really was fortunate because I learned really quickly that dentistry was a chance to not only impact someone's health and improve their quality of life, but for me also to be a little bit artistic, whether it was making dentures, carving teeth out of wax, or doing complex restorative cases. I found myself just pursuing this dental specialty to not only help understand it better, but to impact other people's smiles and life. You have to all the time, in every case, think outside the box and really dial in the treatment plans to an individual approach. And sometimes you don't realize what you haven't had until you've seen it for the first time after the braces have come off. But I tell you, it's a wonderful feeling for me and a privilege to see that first smile when that patient looks into the mirror. We're an office where you're not coming because you have an abscess. We're not coming because you need a filling. We're coming because maybe there's a concern or two about your smile, and maybe it's something that's really impacted you and your personality, how you handled yourself. Maybe you haven't smiled as much. Maybe in a social situation you hold back on that full smile. But when we're able to kind of dial in that smile that you've always wanted, I can tell you as an orthodontist, it never gets old.